I'm from Tigertail Australia, a boutique consulting firm that helps businesses to build their resilience through planning, practice and drills. I'm very pleased to introduce to you this afternoon Mr. Alan Williams from BlinkMobile Interactive. Alan is a director and CTO for BlinkMobile and the original product architect for the Blink mobility platform. As a founding partner of TIBCO and GM Technicron, and having invested over 30 years in the software industry, Alan has extensive experience in enterprise data architecture and designing highly interactive business solutions. Alan will talk to us today about, well, his topic today is From Trading Rooms to Bedpans, Application of Real-Time Event-Driven Architectures. Please welcome Alan.
God, that sounds boring, but it's not. Not used to speaking to such large groups, so forgive me. So what I'm going to talk about today is some stuff that is really quite new in a lot of this health market, and that is the Internet of Things. Now, you know, you've been hearing these terms quite a lot over the last few months. I imagine for the last couple of years, everybody's been talking about the Internet of Things, big data, cloud. There are all sorts of technologies that are exciting people in the computing industry. I thought I'd sort of talk about that in much more practical terms, in a way that some of these things are hitting health, because what you're seeing is a fundamental change in the way that solutions and electronic solutions, digital solutions are being put together. And that's partly because there's a whole load of technologies coming up. Scanners, environmental sensors, movement detectors, temperature detectors. These things have been around for a long time, but the price is absolutely plummeting at the moment. Because what you're finding is that you're getting these devices being able to be connected into the internet and being processed. And all of a sudden it means that you can link up these types of readers, scanners and technologies. And they're things like you've seen for some time, stuff like tags. You've got tags that people put on you, and you've had these in hospitals for a long time. But now you can put radio frequency scanners into these, so that when you go past scanners, an event can occur, and of course that will have an effect on that multiple systems can be told about your transit through a hospital or past a scanner in any type of situation. And what I'm going to talk about is, well, you know, why is that fundamentally different from what's happening at the moment? Well, actually, a lot of the things that are happening at the moment are still very manual in the healthcare and aged care areas. And we're going to talk about solutions that can be put together using these types of technologies, using the Internet of Things and using mobility, because the other big change, of course, is that almost everybody has a mobile device with them at the moment. So how do you use mobile devices and all these scanners and all these sensors in a way that can actually change the way you do your business processes? And I'd say that we're seeing a big change at the moment from process-driven solutions into event-driven solutions. When something occurs, what's going to happen? Context-driven solutions, because of where I am and who I'm with and what's happening around me, I'll get a certain type of interaction and solution. And the third one is data-driven solutions, based on what we know because of people going in one place or another. What different actions will I take based on that data? And those are the sort of new solutions that are really coming up now because of all the things we're measuring and all the things that we're finding out about what's around us. So this whole business of having lots of different devices out there measuring things is going to change the way we think about our work practices. So my background is it was originally in trading rooms, you know, digital trading rooms. So when the Big Bang happened, everybody started trading madly. We provided the information systems that allowed traders to get all their market information and make some sense of it. And in many cases, you know, you've got a situation where a rate changes, and that has all sorts of effects. People start trading furiously, and you get a whole load of different things happening once an event occurs. And so that idea of an event occurring, it could just be a rate changing, would mean that, of course, every trader wants to know about it, but a lot of traders will go and pull that into, say, a spreadsheet. They go and do some additional, add some additional value to it, and sometimes republish that value. There's all sorts of things that happen as a result of an event occurring. And the software architectures that allow that to happen had to be really, really flexible, because in a trading room, there's a whole load of real basics. And the first one is, everything is real time. You're interested in things as they occur. And the systems you put together are very event-driven. Something happens and you want something else to happen as a result of it. There are a huge number of events, concurrent events, and events can have many consumers. Okay, so one thing happens, then there's going to be potentially hundreds or thousands of people wanting to know about that event. And of course, a single event can have many consequences. Also in trading rooms, they always have to be running. You have to rely on them, just like you do in a hospital or a healthcare situation. And you want to absorb new functionality. You want to be able to take advantage of all this new stuff that's happening all the time. In trading rooms, you didn't want to have somebody sort of put in a system that put you as a disadvantage. If you're NAB, you certainly didn't want Commonwealth Bank putting in a system that you would take 2 years to catch up to. And most importantly, these banks wanted to take advantage of the skills of their traders and analysts. They didn't want to rely on their IT departments to provide them all their systems. What they knew that they had bright practitioners. And again, this is very much like the medical profession. You've got a lot of bright practitioners who have ideas, who are thinking, if only I could do this, or only I could do that, and if I could get hold of this information and process it and do something with it, I could actually add value to my particular part of the business. And I reckon that has application in almost every business, but particularly medical. You want to take advantage of the skills and the capabilities of your bright people in your businesses. And the business that we had, a company called Technicron, then became a very large company nowadays called Tibco. We had a huge percentage of the digital trading market. It was upwards of 40% of that whole market, including all the people like Chase Manhattan and Goldman Sachs and people like that, and National Australia Bank and others here. And the reason we got that market share was a lot to do with the fact that we didn't provide a single product for trading. We provided an environment that allowed traders to build up their view of the market really well and to add value to their data really well. What we effectively had was a framework that allowed them to build out of a set of, you could call them almost building blocks, that allowed them to build their solutions really, really easily. I believe that has relevance, again, in the medical market, because there are so many different processes that you might want to think about improving, that really you don't want to be spending 6 months and $1 million to do every one of those. And quite often you can't get the thing that you want for your particular business straight off, off the internet or from a particular vendor. Vendors have very, very good point solutions, and if that suits your particular business, great. But if it doesn't, how do you actually put together something that suits the business requirements of your particular business? So that preamble about trading rooms is quite important, because it's affected what we as BlinkMobile do. We provide a framework that allows organizations to harness a lot of this new technology into solutions very quickly. And when I talk about these types of technologies, I'm talking about devices ranging from mobile devices, so the ability to build apps quickly, web apps quickly, be able to use notifications, email, SMS, all those sorts of things. Being able to link into all of these sensors and readers and that sort of stuff, and weave those into solutions that talk into your back-end systems as well. And I'll give you some examples about these at the moment. The reason it's all relevant now is that there's a commoditization of all these technologies. As I was saying, mobile devices are so cheap and they're so powerful. They're obviously huge computers effectively in your pocket. They can do an awful lot. If you can put together applications that suit new solutions quickly, then you're going to change your business quite dramatically. So one of the barriers to doing all this is that quite often you have to talk to lots of different types of technologies. You have to access a lot of different technologies to build these solutions. So what Blink does is actually provide access to lots of different best-of-breed technologies. We do some of our own. We do low-code development environments for building the apps. A lot of the time we integrate a lot of open-source technologies so that you can come to one place, get support and building capability to build solutions that that harness everything from the IoT devices all the way through to the back-end systems. So to illustrate this, I'm going to sort of get you thinking about a scenario, and this is a scenario of a day surgery environment within a hospital, and we're actually doing this as a pilot in a large hospital group, and we'll see where it goes. But the scenario is quite a simple one, and that is that when a patient arrives at the hospital, they'll register and they'll get an RFID tag associated attached to them. That RFID tag will follow them through their stay at the hospital, and the idea of this is that they want to be able to have it known where every patient is at any point during their transit during the hospital, and they want to be able to allow loved ones or interested parties to subscribe to events that are occurring for that patient through the hospital. They also want to log each event as it occurs, when they move from pre-op to theatre to recovery, maybe into ward and then to discharge. They want to make sure all that's logged as well, because of course there's all sorts of analytics you might want to put in place as that goes on. So in this scenario, which you can actually see over in our booth over here, the BlinkMobile booth just around the corner, we've got a registration where the RFID tag's put on, and they go into the system. And as they come into the system, they're given the opportunity to nominate a number of email addresses and SMSs to receive notifications as they go through the system. And when they do, of course, you can't just start peppering people with notifications. You're not allowed to do that. So what happens is that the users that the patients nominated are sent an invitation to subscribe to that patient's transit through the hospital. And they get that through an SMS or an email, and then they can click through from that, and they'll go into an app. So the app is part of that. So apps in a solution like this are just part of the engagement process. And so when they click through on an app, they'll get a screen up that allows them to then subscribe, gives them a bit more information, allows them to subscribe to updates of their patients as they go through the hospital. And then as the patient starts moving between different parts of their journey through the hospital, they pass RFID scanners. As they pass it, the scanner picks them up. And at each time an event occurs, which is the scanner picking it up, multiple things happen. So it gets picked up by the scanner, gets sent into the internet, through to a service, will then go and send it down into our back end, which you can then set to do whatever you want. And in this case, we're logging each event. We're also, of course, you've got subscription services listening for particular events. In this case, they're listening for updates for particular patients, and they're going to send notifications each time that happens. And so what happens is that each time the event occurs, the people who are subscribed get sent their SMS or email. They can then click through and get more information. Again, an app. So again, the app's woven into the whole solution. They get to click through to an app that will show them where the patient is, and of course, details about visitation and when they can be picked up, etc., etc. So it's all part of, you're using a whole number of things. You're using the scanners, you're using tags, you're using notifications, email, SMS, in-app notifications if you want to. You're using apps, you're using web apps, you're using all sorts of things to bring together a workflow and a solution. And then at the end, of their stay, they get when they go through discharge, they then you can then spark off other things to happen. A discharge notice, you could bring together a report, because of course you've captured every single event as they go through the hospital. You can do things like send them information about who was told when, as they told what and when as they went through. You can use the stats you've picked up in the analytics all the time, and of course over time, importantly, you're building an analytics capability that can look at your whole operation and see how people transit your hospital, etc., etc. So the idea of pervasive analytics throughout almost everything you do is also really important. So every event that occurs in your workflows, you probably want to be able to keep a record of. And then, in this scenario, at the end, when somebody, a day or so after the patient's left the hospital, they're sent again, the back end sets a timer. You then can just send a survey to the patient to get some feedback as to how they thought their stay at hospital went. And so what you've got here is a process. Is it a product, the setting up of that? No, it's not. What it is a solution put together in a bespoke way out of a whole load of services, a bit like Lego blocks, as I said, that allow you to utilize these in various different ways. And yes, there's a little bit of programming involved, but not much, because you've got all these services that you can call on to build up this flow. And the important thing is it can be delivered across all sorts of different technologies. The apps can be delivered on all the main app platforms, tablets, laptops, anything you want. And the whole point about a platform is that you can integrate new technologies. That particular solution integrates QR code scanning, RFID scanning, beacons, all sorts of things like that. And we're very excited about new technologies coming out all the time. I got this the other day. This is called a U-Grocket. I got it from a US firm. And what this does is allow you to scan a whole mass of RFID tags all at once. It'll pick up hundreds of them at once. I love the idea of being able to open a box full of equipment that has tags on, just be able to scan them all and bring them into my app, perhaps see what, if it's a check-in after a checkout, see what didn't come back, and be able to see that immediately. Now, those sort of solutions have been around for a while, but they're very particular, they're very off the shelf, and they're usually quite expensive. What this does is really send the price of building these sorts of solutions down dramatically. And the point about a platform is that it allows you to harness all these different technologies. And when you come across something, you say, I'd really like that integrated. We're listening all the time, and people say, yep, I'd like to have that supported. I don't want to have to work out how to do that myself. We get involved in bringing these new technologies into a platform so that they can be harnessed. So it's very early days in health at the moment, in this sort of commoditized technologies. And we're at this show in many ways scratching our heads and asking you to scratch your heads and saying, if only I could, do what? Based on the fact I know these technologies are out there, what would I like to do in my business processes that could be affected by these new technologies? How could I weave these into new solutions that would fundamentally change my business? And I think it's a time now, particularly in health, for people to start thinking very, very innovatively and saying, how am I going to use this now much, much more commoditized and technology in different ways? And we're trying to get people to think about different scenarios. So, for example, surgeons or doctors arriving at a place and having staff informed so that they can get prepared for an operation or that sort of thing. Just knowing where people are, of course, is one of the basic, obvious things you'll get in almost any situation. Other scenarios are in-house hospital services, directions, you name it. There are all sorts of different ways of using these technologies. And how's it actually happen? Well, I'll just say a few words about the technologies involved. Not deeply, but just to explain that there are a few sets of technologies you really have to try and get your head around if you're going to do it yourself. And again, it's what a platform is all about. And the first of them is the actual devices themselves. There are, of course, a myriad of different devices, ranging from environmental sensors and things to beacons. And if any of you are familiar with beacons, they're just Bluetooth transmitting devices that when you, for example, can get near, your app can say, oh, I'm near this beacon, and you can go to a service that will say, oh, this is you, and that's the beacon, this is what you need in this situation. So these are great for providing context. They're also great for providing information to readers. So I go past a reader, a beacon can be read from a long, long way away. So, not like the bridge toll, which sometimes malfunctions. These can be read from serious distances sometimes, as can powered RFID tags. So part of the question is you need to go to people who will understand how to best use all these different technologies. You get some of these tags are specifically for sitting on glass or sitting on metal, and they perform best in that type of environment. So there's a whole lot of specialization around how you use tags, how you use beacons, how you use all these technologies in their best situation. The next bit is what they call edge intelligence. It's the hubs that bring together these signals and then send them somewhere onto the internet, usually. And so that hub technology or concentrated technology is the next bit. Again, our partner iProximity provide that type of technology. We're showing their IPR hub at our stand, and that brings together these signals and applies intelligence at a local level. So you can just send, you can, for example, combine the inputs from a temperature sensor, a humidity sensor, a movement sensor, and say, oh, there's an alert, it was hot in here and it's humid, the shower's probably on, but there's no movement. That's suspicious, I'm going to send an alert because of that. Now the alert could be just a tweet, or it could be into a business system. All that sort of stuff can be done at the edge intelligence. And then you've got the next level, which is managing all this stuff. It's quite difficult to manage all this stuff unless you've really thought about it. And so the management of it and then mashing together the information from multiple different edge devices is the next level, and getting insight from what's going on. If you've got sensors all around your hospital and you want to get insight for what's happening across the whole lot, then you've got cloud services available now that allow you to do that. And then, where the rubber really hits the road is when you're getting these inputs from all these different devices and you want to do something on a business level with them. That needs to go into a business level infrastructure that then will allow you to set up what happens when an event occurs. Am I going to post something into a back-end system? Am I going to send a notification or an alert? Am I going to send it into an analytics system? Am I going to hold it in a database? All that sort of stuff are the actions you'll take in the solution. And of course, as I said, a single event can usually have multiple outcomes. And you do that in what we call a back-end as a service. You'll see it in the technical terms as MBAS, but it's real back-end as a service. And then, of course, there's the engagement part, which is actually writing the apps that will consume this stuff. And of course, ultimately, when things happen, the most likely way you're going to engage with it is through an app or through a notification of some sort. And so you've got to be able to develop those easily and quickly and get them out there. You don't want to be spending hundreds of thousands of dollars to develop these sorts of apps. And again, a platform like ours allows you to handle the back-end stuff and also develop and deploy these apps in an infrastructure that's really, really reliable. So that's really the sort of thing that allows you to do. And what I guess the one thing I would ask you to go away with is that right now is an opportunity to start thinking, if only I could use this type of technology in different ways. And we're very, very interested in talking to anybody who wants to come by and talk about the sorts of solutions they'd like to put together, because these things are becoming so much more possible. We're talking to aged care companies, hospital groups, medical practices of all sorts, because there are so many things that people want to do that suit their particular business processes that they just can't get off the shelf. My view is, if you can get something off the shelf and it suits you down to the ground, it's the right price, use it. I think that's the best thing to do. If you can't, then there's a real place for a platform like ours. So do feel free to come by and see us. We've got a whole load of solutions that we can show you and help you to reimagine the sorts of things that you could do. We don't have a roundtable this afternoon. That was yesterday. Apparently there aren't any this afternoon. But anyway, I hope that you can come by and see us. Thanks a lot.